finds any solution, and it's worked for us. I thank you for your attention.
We want to thank Reverend Fowler once again for what a stirring presentation to remind us that it is more than housing. However, housing becomes the anchor to all other opportunities. If you ever have a chance while you're in the city of Detroit, please look her up. Please buy any of the books that she may have brought with her. We want to make sure we lighten her load. I don't want her to take any books back with her. Let's make sure that we take advantage of the opportunity to learn more and grow in our own awareness and understanding of what's possible. She mentioned Dee and Mr. D. I've never had the privilege of meeting. I did meet some of the team and staff and residents while I was there. I hope that my opportunities will also cross his one day. I would welcome an opportunity to shake his hand. The joy in hearing her presentation brings a smile to my face and understanding before the houses went up, we're not sure if people believed. I can tell you that we are 6 hours away in travel time in the Quad City, along with so many others, believe as well. Thank you again, Reverend Faith. I appreciate your investment into the lives of so many others. As we have continued to bring voices to this stage and behind this podium, to be able to highlight the reality of so many things that so many have to grapple with and deal with and manage the reality that we call life. With the looming healthcare cuts that are causing fear in many families across the country, no one likes to choose between food and medicine or other needs. Today we will hear from Avionna Johnson, who represents thousands of working Americans who are wondering what Medicaid cuts will do to her family and the opportunities they have before them. Will you help me to welcome Ms. Avionna Johnson?
My name is Avionna Johnson. I'm from Looming, Illinois. I am married to Johnson, and I'm also a mother of 3 young girls. We have been involved with Project Now Head Start for about 3 years. I currently have a 4-year-old daughter, Monty, that's in Project Now Head Start. It provides a great education. We love our Head Start family to get them ready for kindergarten and on. I currently work as a CNA. My husband works as a floor tech, and we need 2 sources of income just to make day-to-day needs. And we rely on Medicaid to help with our daughter's insurance. We have had Medicaid for about 5 years now. The last 4 years have been tremendously helpful because our youngest has acute asthma. So with my youngest daughter having the acute asthma, we had our share of ER visits, doctor visits, special doctor visits, the whole 9. So just like with her having acute asthma, as simple as her playing at the park, a cold, or anything will send us to the ER, or even her being in hospital for 3 or 4 or 5 days. It just depends. So imagine being a 3-year-old, 4-year-old, 2-year-old, we can't tell you how they feel when they can't breathe. That's her. We realized that Amani was having breathing issues around September of 22. We didn't actually get a diagnosis for her acute asthma until after her 2nd birthday. They had like all the special testing and all that good stuff in order to make that diagnosis. Our family is thankful that we had Medicaid, because if not, I don't know how we'd be able to afford all her health care, her medicines, her visits, the specialty visits, the ER visits, the hospital stays that came along with it. And with the Medicaid help, I don't know. My husband and I both work. We don't know how another family who doesn't have income, who's struggling by themselves, will be able to pay for the medical. Especially, we have a child with acute diagnosis I can only imagine like the cancer treatments, you know, like any other diagnosis that's super expensive that a normal person would not be able to afford. My family, we're worried that the cuts would be hard to choose to which bills would be most important and what's not that important. Because like I said, we're a working family of two with 3 girls. It's hard.
It is.
So with the cuts that they are wanting to do, I feel like we ought to say no. Fight as much as we can. Because it's expensive, like super expensive. And we don't want, it's already hard to make ends meet as a 2-parent household. So why put someone else through that if they don't have to? It's truly scary to think what would happen if they do make the Medicaid, Medicare cuts. Because there's not much. Even before we had Medicaid to help us, our kids and medical expenses, our co-pays, our bills that we were getting were outrageous. Like it was dead before it even happened. Like it was terrible. It's scary to think what families are going to have to face when that time comes. To me, the cuts are wrong. It will hurt everybody, even the hardworking families and even the ones who can't work medically or because whatever their situation is. It's gonna be hard, and they shouldn't make the cuts. Because how are we can barely afford food, we can barely afford daily living expenses. It's hard, you know?
It is, absolutely.
In my personal opinion, Medicaid has helped my family tremendously, and hopefully they won't make the cuts, so we can continue to get the care that she needs, because if they were to cut that, doctors' visits would be even longer, would be more expensive. We won't even be able to get basic care that we need as human beings. Like, it's gonna be hard. And the help goes a long way. Like, people don't understand how hard it is having Medicaid because of the simple fact we can only see certain doctors, or we can only see certain specialists, or we can only be seen at certain places. But in my opinion, as long as my daughter gets the care that she needs, that's all that matters.
That's right.
Thank you for letting me share my story.
Great job.
What else?
Would you help me to thank once again Ms. Johnson for such a powerful testimony of the challenges. It takes an enormous amount of courage. My text started the family. They want